Welcome to Views and Opinion on MCCPTV, where your voice matters. We all know the magnitude of the impact of coronavirus on the whole world in recent time. As novel as it was, it took the world unaware. The enforced lockdown was the best option the World Health Organization could come up with then, although the lockdown that followed stifled economic activities everywhere. Do I need to remind you of the fact that palliative was withheld here in Nigeria, as you remember the palliative wahala? Now we want to look at how all these affected the world. We have interesting and informed views which you would like to hear, and also an insight into a senior staff of World Health Organization's take on the control method recommended by the World Health Organization. This is a special edition of Views and Opinion. Don't go away.
We in the World Health Organization do not advocate lockdowns as a primary means of control of this virus. The only time we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health workers who are exhausted. But by and large, we'd rather not do it. Just look at what's happened to the tourism industry, for example, in the Caribbean or in the Pacific, because people aren't taking their holidays. Look what's happened to smallholder farmers all over the world because their markets have got dented. Look what's happening to poverty levels. It seems that we may well have a doubling of world poverty by next year. We may well have at least a doubling of child malnutrition because children are not getting meals at school and their parents in poor families are not able to afford it. This is a terrible, ghastly global catastrophe, actually. And so we really do appeal to all world leaders. Stop using lockdown as your primary control method. Develop better systems for doing it. Work together and learn from each other. But remember, lockdowns just have one consequence that you must never, ever belittle, and that is making poor people an awful lot poorer.
The coronavirus is called novel coronavirus because it's new. It is the kind of virus that people have never seen before. And the way it is behaving has never been experienced by people before. Like before, you find the virus will affect people and they develop immunity. That's they develop the ability to fight it if it comes next. But we're now finding out that coronavirus comes and goes and comes again. So it is something that we have to handle with care because we don't understand it. And there are two ways of dealing with the virus by taking measures to make sure people don't get infected, or allowing people to get infected so that they can develop immunity. Now, you see, because it is new coronavirus that can infect people and reinfect people, it doesn't make sense to allow people to get infected until we know what's going on. That is why some people are saying, no, don't allow that to happen. Too many people might die before you find out what's going on. So that is the debate that's going on. What Des Nabero is suggesting is called herd immunity, because if a group of animals are infected, one of them gets infected, they are not likely to take any sanitary or public health measures to save the others who are not infected already. That's what makes the difference between humans and animals. Animals allow herd immunity, but humans normally don't allow it. They engage in isolation and so on and save as many people as they can. So that is what the issue with that.
The handling of the COVID-19 situation by the WHO initially was on point, was good. The media helped, health professionals helped in creating awareness of the new virus. At the time, making people know the situation we have on ground and the impact, the possible mortality and morbidities being caused by this new virus. Now, whether the lockdown was necessary or not, initially it was. I would say it was. Being a novel virus, a new disease, the healthcare professionals, scientists, lab scientists and other pharmacists, people needed to understudy the virus. So, like I was saying earlier, initially the knowledge was that the virus spreads by aerosol. Aerosol is when you cough, it drops. So whenever it drops on a surface, you touch it, you can get it. But at the point, some knowledge came out again that it spreads by airborne. Airborne is that when the patient coughs, the virus particles continues to circulate in the air. Anybody who comes into the environment can actually take in the virus. Now, these are studies that were going on. People were trying to understand the epidemiology, the pathophysiology, everything about the virus at the time. So the issue of shutdown, people needed to stay at home for that process to go through. Now that has been completed, at least to an extent. You have knowledge about the virus now, how it spreads, who is affected most, the elderly, not so much impact on children, people with underlying conditions and all that. So there's adequate knowledge to an extent, not fully, but to an extent, to have adequate knowledge on how to handle the virus. So I think what we should be talking about now is how to live with the virus.
Just like in every other part of the world, the coronavirus, the impact has been very devastating. It's led to a lot of introspection. Let's take, for instance, a country like Nigeria. The coronavirus has exposed 110% the very, very bad, defective health system we have. You see, we lost the chief of staff to the president to coronavirus, and we've had so many untold deaths. We've had people trying to go outside for treatment and they can't go outside. We've now seen that our hospitals can't even diagnose simple things. We've now seen that we now have to start to put up laboratories to be able to determine and to correctly detect and confirm a viral disease like coronavirus. So the coronavirus, I wouldn't say is a blessing in disguise. I wouldn't say that because people may misunderstand that, but it has helped countries like Nigeria to have an introspection into their health system, into their social system, into their social welfare, into everything that has to do with the citizen. Before now, say Jack Robinson, anybody that has money goes to London, to Germany, to anywhere to have treatment. Now we've known something can happen in the world where you can't be able to travel. You must have to depend on the health system in your own country.
Some countries and states avoided strict lockdowns because of their collateral damage and unpopularity. Did those jurisdictions suffer rampant spread of COVID-19, overwhelmed hospitals, or massive deaths? It appears not. According to Worldometer, states in the U.S. following strict lockdowns in the winter of 2020 had more COVID-19 deaths per million, 1,558, than non-lockdown states, 1,475. Also, 3 recent studies in prestigious medical journals have shown no benefit to lockdowns in reducing COVID-19 mortality. One study concluded, quote, "We would have expected to see fewer COVID-19 fatalities in countries with a tighter lockdown, but the data reveal that this is not the case," unquote. While countries following an open health policy did not fare any better than lockdown countries with respect to COVID-19, they most certainly avoided the massive collateral damage. Of course, public health authorities and governments that used lockdown policies will vehemently argue that they were a necessary evil to stop COVID-19 and save lives. If they see this video, some might attempt to gather their own sources and studies and try to discredit my assertions. That's their right. What they do not have a right to do, however, is ignore the damage done by their policies or the fundamental right of human beings to manage their own lives and health in a free and responsible way.
It shouldn't be total lockdown. It shouldn't be total lockdown because people's means of livelihood are being affected. So government should always find a way of curtailing this thing, and the citizenry as well should also find a way of staying safe by wearing their nose mask and maintaining the social distancing and all the rest of them.
Since last year, students have been at home, and here we don't have e-learning that will enable us to learn inside our home. So my suggestion and my opinion is that government should open school, more especially school, and also ensure that students apply the measures, the principal measures that will be assigned. Students to make sure that they apply it, and also ensure that there is social distancing both in the class, and also the class should be fumigated. They should fumigate the class. Make sure that everywhere is cleaned, both the seats, everywhere, more especially students.
It's going to be terrible and very hectic because, as you can see, with the one we experienced last year, there wasn't any progress in the side of people. People suffering, a lot of people died and whatever. I know it's important to protect the citizens in terms of the COVID, but there are some incentives, some palliative. They are being given to other people and the other countries. I mean, the people here are suffering, and we don't have any benefit from the government in terms of disaster, in terms of problem. No other benefit. But the only wish for us to be doing according to their wish. But I know in every country, the government, more especially, care about the citizens, the well-being of the citizens, and not to be controlling them, punishing them in terms of disaster, in terms of problem. When they need their help, they will not find.
The vaccine came out, the Bill Gates Foundation was funding the vaccine. It came out. I became skeptical as a healthcare giver when they said they wanted to start testing it in Africa. So the question is, why not start with your people? Why do you want to start testing a new vaccine on Africans? Taking us back to what it was then, those days where they used Africans as guinea pig to test whatever they want to test. So that was my thinking, and they were actually pushing it to countries. Some of the small African countries actually were going through the vaccine. So why don't you start with the West? You have the vaccine, you produced it, and you know it's going to work. So you want to come to Africa and test before you now start using it on your people. So I was a bit skeptical then. But vaccine, I think, is the only way out. But let it not be that, because if Africans become skeptical, we're not going to blame them, considering what has happened in the past, hundreds of years ago, tens of years ago. So the vaccine is the way forward, but starting the test running of the vaccine in Africans, I'm a bit skeptical.
I hope you have been enlightened more about the COVID-19 pandemic, the effects and the impacts of the lockdown measures to control its spread. Should the world still be talking about other phases of lockdown? Shouldn't we rather learn how to live with the virus and take precautions, as it seems the virus is here and may be with us for a while? What's your thought on this? Let us know in our comment section below, and follow us on our social media handles displayed on the screen to like and share. For partnership and inquiries, contact us via our WhatsApp number. Till I come your way next week, I am Chidima Ogbochi.